What's up, ladies and gentlemen? Welcome to another episode of Off the Mat, your mental health check in for athletes across the world. Today, I am joined with my guest, professional in the healthcare industry of neonatology, former Division I athlete from the University of Pennsylvania, has two kids and a father, Ed James. How you doing today?
I'm good, Sean. How you doing today?
Good, good. Can't complain. Let's just get right into it. So, tell me a little bit about yourself.
Well, thanks for having me. So I'm a neonatologist. That not a lot of people know what that is, but that's my profession. So I take care of premature babies, and whenever there's an infant born who has some sort of medical complication, then the neonatologist, myself, and my team come in to take care of that baby. I'm a happily married person. I have two children who are now adults, and those are the three people that are the greatest joy in my life.
That's fantastic. So, not only are you a professional in neonatology, like I mentioned before, you were also a Division I athlete. Can you tell me a little bit about the sport you did and why you're interested in it?
Yeah, so I was a sprinter. I went to the University of Pennsylvania in Philadelphia. I guess it started way back when I was a young kid growing up at the time we lived in Queens, New York, and I understood early on that I could pretty much outrun everybody
There you
on the
go.
on the block. We played stickball and football, and so that's kind of where it started. And then I was fortunate enough to go to an excellent high school in New Jersey. We'd moved out of New York by then. I was a New Jersey state champion. Then went on to University of Pennsylvania, where I had a great career as a Division I collegiate sprinter.
So, you lived in Queens, but you were New Jersey state champion. How does that work?
Yeah, so it's part of my personal journey. So we um, moved to Queens um, when I was very, very young. My dad was an engineer. My mom was a nurse. So we moved there. I was there in elementary school and the beginning of junior high school. The neighborhood began to change. I remember an extraordinarily impactful event where one of my good friends unfortunately overdosed from heroin.
Oh, no.
And then that point, and not that was necessarily the cause, but certainly temporally, time-wise, it was a impactful time because at that point we left New York and moved to New Jersey. So we lived in New Jersey. So of course I went to high school in Jersey.
Got you, got you. And from there, you pursued a track career in New Jersey, correct?
Yeah, yeah, in high school. Yeah, yeah, exactly,
How
exactly.
did you develop this passion over time? I mean, track and field is such I would say a competitive sport, and not a lot of people like running, especially just on their own time. So how did you manage to find a passion in an organized sport like this?
Yeah, it's a good question. I mean, I think for me, I was always an academically oriented person, but I really really wanted an outlet. So, I got to high school. I had the sort of non-organized experience of being someone who could run fast in New York. But then when I got to high school, I found that I wasn't really very competitive, interestingly enough, at the beginning. So
Hmm.
it was a matter of proving myself. And again, it was a great outlet for me away from the classroom.
Absolutely. I think as high school, we've all been through high school, and having to balance being an athlete and a student is probably one of the most difficult tasks, especially early on in life. I mean, I know for myself, I did three sports, let alone one. And, having to balance that every season, life is like seasons, but they're always like, life is like seasons in the fact that, you always know when they're going to come. They always show up, but yet they still surprise you and they're always so difficult. And, having to balance the academics with the sport that you like is very difficult, but very rewarding at the same time. How do you how did you balance? How did you manage that, especially in high school and with your personal life? Obviously, you've lost a friend and you moved. How did you juggle all those things at an early age?
Yeah, it was tough. First of all, I had a very supportive family. I mean, I was
Good.
blessed with a mother and a father at home, so I had that, and that grounded me. I had a sister and two brothers, so I felt very much grounded to the family. But I mean, I think my athletic career and my academic career kind of fed off each other. I mean, again, I was extraordinarily blessed, and I did well in both spheres. And I hadn't heard that the four season analogy before, but I like that because yeah, it's a changing process. But I think I really use one to feed off the other. So as I got, if I had a success in one and maybe a failure in the other, I can look to the success I had in the one. So I use them both to kind of help me get through the other. I had a bad test. I maybe have a good day on the track. I had a bad day on the track, and maybe I ace a test. So that was kind of the way it worked throughout my high school and college years for sure.
Yeah, I mean, thank you. I mean, the season analogy comes from Tony Robbins, actually. I was watching one of his seminars. He says, life is like seasons. You experience joy and sadness. It's obviously like I would say maybe metaphor, personification, but it's just like that, where you have your ups and downs in life. Like you said, you had a bad test, so you had to make up for it in track, and balancing those things. Who was your biggest influence in your life?
Yeah, that's a great question. I'd have to say many people did. I mean, I go back to my mother and father. I mean, my dad. I might get a little choked up here. My dad died last February, so
Oh, I'm
very
sorry.
very recently. He was my biggest fan on the track, and I think he was my biggest fan in life. My mom was also extremely influential academically. So it's interesting that you asked the question because I think academically, my mom was really the one that pushed me, and then on the track, my dad really pushed me. But the other person I think that really influenced me, of course, growing up was Martin Luther King. So
Mm,
the time with the civil rights movement. I was born in 1954, so in the 60s, that was quite a tumultuous time, obviously, in this country, and um, Martin Luther King was really an inspiration for not just me, but for many African Americans in this country. But I think I have to really lean back to my parents as the two people who really made me what I am today.
absolutely, and I'm sorry about your dad passing. It's very sad, especially having your foundation, the people who keep you up in that support system. As you can see, they probably brought you through a lot, and without them, you probably wouldn't be talking, let alone what you would be where you're at. And so that's very sad, but you know, not often. It's very difficult to, like I said, juggle school and everything like that. But I remember we had a prior conversation. You said that you don't feel normal when you don't have track and field in your life. Walk me through that feeling. Like what are you going through? Because obviously you succeeded academically to go to a prestigious school like University of Pennsylvania. How did you make it work if you weren't feeling on all the time?
Well, the question about the loss of track and field, for lack of a better description, since we're talking a lot about loss, it appears right about now. But I mean, when I went to continue the description of my journey, so once I left college, I went to medical school. I went to Cornell,
Mm,
again, great school, but I abandoned track. I mean, I just immersed myself completely and totally in the academics. And what I didn't realize, I must say, I don't think I realized that how much and how important the athletic part of my life was in terms of my
mm,
academics. So when I got to Cornell, the medical school, which obviously, needless to say, was extraordinarily demanding academically, I really missed the outlet of having the feeling of running and the staying fit, which is mind and body, right? So I abandoned that kind of cold turkey, and frankly, looking back, medical school was one of the four most difficult years of my life because I didn't I just felt so unbalanced. I didn't have the outlet, and when I struggled academically, I couldn't lean back, could not lean back to track to help me through.
Why did you feel like you had to abandon track and field? I mean, it seemed like, I guess let's just keep it at that. Why did you feel like you had to abandon it?
Another good question. I mean, hindsight's 2020. I was very young. I had achieved quite a bit on the track in college, and just kind of thought that I really needed to immerse myself in medical school and just get the most I could out of it, and felt like if I just spent more time, I would do better academically. But again, in retrospect, it turns out the reverse was true. I didn't perform as well academically in medical school as I did in college without track.
So what happened next after that? Did you go back to track or you tried to push it through?
Well, I pushed it through with varying degrees of success, and then went on to my training. I didn't really get back to track until, interestingly enough, I didn't get back to track until, oh my gosh, probably 20 years later. So 20 years
Mm,
after I left college,
wow.
that's about right. Yeah, that's about right. I went back to track finally, and I ran as a master. So I guess 40 plus, 40 years old plus. So I went back to track just to remind myself, of the joy I felt running. And again, I had some success as a master's runner. And then I was finally ready to kind of give it up. But in medical school, I really felt like I had abruptly ended my career. I mean, at that time, so that was like mid to late 1970s, early 80s. There
Wow.
really wasn't an opportunity to run professionally. Of course, now that's just totally changed. I mean, not now. If I was young now, I'd probably move into a professional level of track and field, and then go to medical school after that. But at the time, that wasn't available, um, and I just decided to immerse myself in medical school. I wanted to be a physician. I knew that was what I wanted to do, so that wasn't really the issue. But I just couldn't balance I felt unbalanced without the track during medical school.
So how old were you when you stopped? You said it was 40 years. How old were you at that time?
Yeah, so I mean, I was young. So I graduated at 22 from college,
Okay.
and that's when I stopped my. I mean, I literally, I was fortunate enough. I don't tell this story often, so I appreciate this opportunity. It's
No problem.
cathartic for me. Um, but my senior year of college, I was an Ivy League champion. I was the Eastern Region champion. I went to the Olympic trials in '76
Oh, wow.
in Eugene, Oregon. Didn't make the team, obviously, but I was there. And then literally that was July. I want to say that the trials were probably in July, and I stopped. Literally
Mm,
peak of my
peak of your career.
career, I stopped. I started medical school that August, September, and that was it. That was it. And I didn't get back to it till 20 years later, and started to get back in shape, and did about, I think I ran for probably a good 4 years as at the master's level, aka master's means old, so the whole master's level. And
Well refined. Well refined. Definitely. I think, well, walk me through that process, I guess, because you talk about, being so passionate about track, but here's something that overshadows track, and it's now medical school. Like, what is going through your mind while you're making that decision? What are you saying to yourself, like, to be like, listen, I can't do track right now. Like, are you thinking that medical school is more important than track at this point? Like, walk me through that mindset decision making.
yeah, it's a great question. But yeah, I think it's that was pretty much it. I mean, I knew, my parents, back to my parents, had a extremely, very very strong work ethic that
Okay.
they instilled in us. So it was about, it's a good thing, and it's about getting a career. I had accrued some bills during college. They paid a chunk of it, and then I took out loans for medical school. But it was about getting the degree. This is like 1980, so things have changed a bit since then. But it was about getting the degree, getting training, and getting a job, paying back the loans, starting the family. So that was really the focus. I must say, at that time, I didn't understand um, how important my track and my athletic career really was to my spirit, my well-being, psychologically.
Mm.
I didn't appreciate that till, after the fact.
Well, it sounds like your parents were they kind of pulling your arm a little bit because it almost sounds like, oh, I had to do it. It was more like a group decision more than just you. Is that the fact?
Yeah, I mean, I think that's fair to say. I mean, I
Okay.
think, I mean, had there been a professional opportunity for me to run like there is
Oh
now,
yeah. Mm-hmm.
I'm sure I would have run, but that wasn't available. So that meant I had to take time off from my education, pause my career. I guess I could have run. I didn't think about this till just a second, but I guess I could have
No
run
worries.
at some level um, at college, but I mean, in medical school, I'm sorry, I think I could have possibly have done that. But I went to a medical school, and it wasn't unusual at the time, but medical school at that time was kind of an all immersive process. And I remember distinctly, I was struggling, and so I decided to move off campus. And my sister had an apartment. I don't know how well you know Manhattan, but it was in the Cornell Medical Schools in Manhattan. It's on the Upper East Side, and I had my sister rented an apartment in Chelsea, which is sort of like the
Hmm.
Village.
Yeah.
So I
Nice
moved in
place.
with yeah, very nice. Moved in with her. Um, and I remember I went to the dean's office to tell them I moved, and just to give them the information. Here's my new address. In case you needed to find me. There was no social media. There was no cell phones. Everything was snail mail. So I had to give them my
Hmm.
address. So I remember I'm in class, and after class, I get called. The dean wants to see me, the actual dean, not just
Oh
the
wow.
office, the dean. So the dean pulls me in and says, we really don't think you should move off campus. And I said, well, why? I mean, it's expensive to live on campus, Upper East Side versus Chelsea. I mean, I wasn't a wealthy person. And they're like, no, we really feel it's very important for you to stay in the community, um, to really immerse yourself in the academic career that you're pursuing.
Yeah.
So I actually got dinged for moving off campus
Oh
because
my gosh.
they really wanted you to focus in on uh, the medical education. Again, this is now 40 years ago. So that was part of it too. That I really didn't feel like I had much
Got
wiggle
you.
room to explore other options. And certainly my classmates, that was kind of the universal feeling. It was all medicine. It was, you
Yeah.
know, morning, noon, and night medicine. We did everything together, ate together, studied together. It was 24/7 medicine.
Being a med student and other people probably taking the same route of you as you even now, the process is very refined. Everybody has to go through it. Everybody knows. Walk me through the day to day and what you're feeling, because now you've kind of I'm assuming a lot of med students have had to make this type of sacrifice where they were really good at something and they had to stop and be all med school. Walk me through the day to day and how hard it was to manage that new schedule, having to detach from your old schedule, your old passion, and now being immersed into this. How hard was that to manage, especially now that you're in a serious business that is probably one of the most needed businesses in the world right now?
Yeah, I mean that back at that time, um, it was certainly. I mean, looking back, I think we had this brief conversation earlier, but looking back, I don't think there's little doubt that I was anxious and at times depressed. I'm quite certain of that. Um, the way you sort of process it though is you kind of look around, and this is kind of what the dean was suggesting to me. You look around, and my peers were all doing the same thing. They were all totally immersed. So I felt like I had some support with my peers in terms of students because they were doing the exact same thing as me. So felt like I had that. Um, they had my back in terms of this day to day. We did have, I did, what did I did? We did have a couple of, what do we used to do? We used to play a little basketball. Um, So that was kind of the extent. There was very little. It's very little. I'm laughing now, but it was very little then. But the day to day was, leaning on my classmates who, when everybody's kind of going through the same thing at the same time, you do get some solace. But there were some pretty lonely, anxiety producing, depressing moments. I had a good group of friends from college they're my friends today. So when I did have a break, I was able to kind of get away from that, spend time with them, and most of them were not in healthcare or medicine. So that was pretty much how I got by with friends. My family was still supportive, and my colleagues, my fellow students were there when you're feeling down. Everybody's doing the same thing, and we kind of rally each other to try to get through.
Yeah, so it sounds like there was a sense of camaraderie as well as, family. Uh, was there any other practices or methods that you use in order to kind of, give yourself some breath and, get through it? And maybe a recommendation you might have for somebody who's going down the same path in order for them to kind of feel like they need to, get away a little bit.
Yeah, that's a good question. I mean, one of the things I remember doing with my best, he's still my best friend today. We used to, it's going to sound pretty funny, but we used to, during the nicer weather, we would walk. So Manhattan's an incredible place. So we'd walk, we'd
Yes.
do Central Park. We'd walk, we would walk from like the Staten Island ferry, which is kind of the bottom tip, the southern tip of Manhattan, and walk up to Harlem.
Oh, wow.
So we do these walks. We did walk Fifth Avenue, walk Madison Avenue, and we talk the whole way and just kind of decompress. He was actually in medical school too, but we kind of decompress that way. But I think, in retrospect, and I think things have changed for the better.
For sure.
So I think now, there's a recognition that balance in life is important, and this immersive, all or nothing approach to academic, in this case medicine, is not the healthiest route. So I know now, um, that in medical schools, they actually promote and encourage activities outside of the classroom. So
Really?
that's a big change. I would also say that, if you look at, and I think this is, you could probably look this up, and it would be true that the age of medical students is increasing because, well, at least compared to when I went to school, because when I went to school, medical school, um, most folks went, high school, no break, college, no break, medical school, no break, residency, did the whole
Wow.
thing without any breaks. Now, uh, I won't say it's the norm, but it's much more common to find an individual like myself. If I use myself as an example, fast forward 40 years, I would likely have, gone ahead and continued running. Take a year to do that. Uh, you can enroll in medical school, defer for a year. If you don't lose anything, get that year um, of an academic break. Explore, in this case, track career could be other things. You could explore art, you could travel, and then jump back into the immersive experience that's called medical school. I think that would really be uh, a much more healthier way to pursue medicine today. Is, take care of, not just the academic part of your brain, but the non-academic part of your brain as well as your body,
Mm.
and your mind, the psychological part of your brain. Um, Nourish that, and then jump in and do medicine.
Got you. I guess to sum it up in one word, and I'll ask you why afterwards, but to sum it up, do you think you could have ran and would you have been able to fit it in your regular rigorous schedule? And how different would your life be different if you were able to do that?
Wow. I don't know if that's one word. uh, you know, uh, I don't know. Since we
Why?
first talked about doing this, I've been thinking a lot about it. I don't know. I don't know. I mean, I think 'cause
Mm.
part of the issue was, um, I remember I told that little story about moving off campus, away from the medical
Yeah.
school campus,
Oh, yeah, that's right.
and
That's
getting
true.
pushback from the dean. I think I would have gotten pushback, if I certainly if I asked for time off, or if I, didn't show up at the, you know, the post dinner lecture that we had because I was out running somewhere. I'm not sure that would have helped me academically. I think I would have probably had more struggle. Again, this is then. I'm sure that would not have happened today, but back then, I'm not sure I had other options. I mean, the other pieces, we were, it was much more challenging as an African American student. So I had that kind of hovering over my head too. Not just me, but the other African American students in medical school. So we had that added pressure on us. So I'm not sure I could have done it. I'm not sure I could have done it.
Absolutely. So, fast forwarding, now you're into the job. Give me your experience, everything that you've accomplished in the neonatology field.
Yeah, well, all in. I'm very happy. I mean, I've had a great career. I mean, I always wanted to do so-called clinical medicine, so I always wanted to be at the bedside. Um, Neonatology obviously is not a specialty since you're dealing with babies. It's not a specialty where you communicate directly with your patient, but you
Mm.
do communicate with the parents of very, sometimes very sick newborns. And I was able to navigate that and to help parents through a very difficult time. My career advanced. I was a medical director. Um, Now this is my third newborn intensive care unit that I've been the director of. So, I've got the leadership experience and just had, great career. Many years at Danbury Hospital, then on to Yale, and now I'm working at a unit um, affiliated with the University of Connecticut. So my career has been very special and very, very gratifying for me.
Fantastic. What's the hardest part of your job, I would say?
Yeah, it's an easy question, difficult but easy question in that um, hardest part is when it's rare. Thank God, literally thank God. It's rare, but when a baby passes away,
Mm.
when you're trying to help make them better, that has always been the hardest part of my job, and certainly you know something that you don't really get over. You sort of learn to adapt. You learn to cope. At least for me, anyway. Speaking for myself, but it's not something you ever get used to. It's very,
Mm.
very difficult. Again, rare, but when it happens, it's devastating.
So, in the neonatology kind of field, you deal uh, obviously with some rare death, but you also deal with pain, correct, within the infant or the baby?
There's a lot of aspects to caring for babies who are sick, whether they're full-term babies or mostly premature babies. But pain is certainly uh, a part of what we deal with pretty much every day. Yeah, yeah.
So, what are the best practices for managing neonatal pain? And what are some things that maybe even parents can do at the same time?
Yeah, it's an excellent question. Excellent question. I mean, it's and the beauty of neonatology and the challenge of neonatology is, for me anyway, my career was when I started. Well, neonatology is a relatively new subspecialty of pediatrics.
Yeah, actually, can we let's go back. Explain what neonatology is first and like what you do specifically on a day-to-day basis.
Fair enough. Fair enough. Fair enough. Yeah. Um, so neonatology is it's most of the specialties the words are derived from Greek.
Mm.
Uh, Gr- um, So neo's new, natal is birth. So new
Mm,
birth is the origin of the word. And we are pediatricians, so pediatricians care for children. We're a subspecialty of pediatrics. So when you leave medical school, you go for pediatric training, which is all children. And then after that, and I did that at Einstein in the Bronx in New York. And then neonatology, you go to an additional training period, lots of training. I went to Columbia in New York City. I went back to New York City for that, where you learn to care for newborns. So the
mm.
day to day is, it's a very unpredictable specialty because you never quite know when you're going to get the baby who needs your help. It could be a
Mm.
baby that suddenly develops problems at the end of the pregnancy during labor. It could be a baby that's born prematurely. Babies are born after 40 weeks of gestation is the way we talk about it. So 40 weeks is normal. We now can care for babies as early as 22 weeks, 23 weeks. So that's
Oh wow.
17, 18 weeks early. So the babies can literally fit in the palm of your hand when they're born. So we take care of a plethora of problems. I mean, from head to toe, from brain issues, eyes, hearing, you name it, eyes, lungs, heart, liver, kidneys, adrenal gland, limbs. You have to know a little bit about everything. So that makes it I think fun, frankly, and challenging because you're always having to think about physiology and how the body works. And premature babies' bodies are not fully developed, so the function that the certain organ was supposed to do, let's say the heart, is impaired because the heart is not fully developed. So you have to develop we've developed therapies to care for those organs until they've had time to develop normally. So there's a
And
lot.
so you said this is kind of new. How long have you worked in this area since it's new?
Yeah, so the specialty, I mean, so it's all relative, right? So
Hmm.
the specialty came into being in the mid 50s, early 60s. So that's
Gotcha.
a while ago.
Hmm.
But in the
Grand
scheme of
scheme.
medical history, yeah, the scheme of medical practice in this country, in this world, it's very, very new. So during the frustrating part is, in fact, some of the practices that we employ to help these babies have been deemed to be detrimental. So we've had to change our approach to some of these medical problems that we encounter with these babies because we found better ways to literally take care of them.
And do these ways include medication? I mean, it seems like if a baby is too young to really process medication, like, do you still give it to them, or you mentioned therapies? I guess can you elaborate on that a little bit?
Yeah, well, it's medications, and you have to adjust the doses. I mean, obviously the baby's physical size is so much smaller than even a child. We give minute doses of medication. We had to sort out what the proper dose was. The other good slash bad example is oxygen, right? So we all know oxygen is important to sustain healthy life.
Yeah.
So knew that premature babies in particular had lung problems, and obviously the lungs are responsible for getting the oxygen out of the air into our bodies so we can stay healthy. The lungs are impaired, so the premature baby's lungs' ability to process oxygen is diminished. So we used to give oxygen. Makes sense.
Hmm.
Um, what we found out though is we were giving too much oxygen
Mm.
because what happened was, and sadly, is if you give too much oxygen to a baby, remember I was explaining that the premature baby's body is not fully developed. And this is quite complicated, but I'm trying to simplify it. But the eyes, for example, the eyes are not fully developed when the babies are born prematurely. It turns out that if you give too much oxygen to help the baby survive, oxygen can damage the eyes.
Mm.
So unfortunately, there were many babies who went blind. So now we know, so we titrate. We give the exact amount of oxygen that's required for health, but not too much to injure the eyes. So that's
Gotcha.
That 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 story probably is, gee, let's see. I'm going to say it's about as long as I am old. So that's about a 50 to 60-year-old story from start to
Wow.
finish in terms of sorting that all out. But it's a fascinating subspecialty in that regard because we're learning new things about babies all the time, all the time.
Absolutely. I have a couple more questions regarding neonatology, especially for people who have kids now. Do you still work with kids like even after they're born and like, newborns and their families and helping them?
Yeah, another great question. I don't, but there are some neonatologists who do what's called developmental follow-up.
Mm,
So babies, once they leave the newborn ICU, healthy, happily, hopefully, then there are, and these are pediatricians, some neonatologists like me who do this. And what they'll do is they'll follow the babies after they leave the newborn ICU to literally see how they do and try to discern what are some of the things that we could be doing differently again or better said, better, to improve the outcomes after the babies go home.
mm.
So that's a big part of an area of research that a lot of neonatologists are involved in. Not me necessarily, but certainly something of great interest because we obviously want to know how the babies do after they leave the intensive care unit.
So I guess for you specifically in your career, what age, weeks, months do you work with the baby until you're like, your job is done, I guess?
Yeah, good question. So I work with them while they're in the intensive care unit. And remember, I suggested the prematurity issue is primarily what we do. So if a baby, let's say a baby's born, let's just say 8 weeks early. So instead of being born at 40 weeks, the baby's born after only 32 weeks.
Hmm.
So not surprisingly, that baby takes about as long outside of the womb to fully develop to the point where they're healthy enough to go home as the original due date. So if the baby is 8 weeks early, it takes us somewhere between six, well, 4 to 8 weeks um, in the hospital before they're able to go home. So they're there for a good month, 6 weeks. So during that period of time, myself and my team, the team, not my team, but the team, sees them through. Once they're able to literally behave as a full-term baby, so breathe normally, eat well enough to gain weight. They're very tiny, so they can't maintain their temperature, so they have to be kept in the incubator. But once they're able to maintain their temperature, eat and breathe, they go home. And at that point, my care as a provider ends, and the pediatrician takes over.
One last question for you. For somebody that is trying to go down the route that you're going, what is a couple words, maybe even a sentence of advice that you would give them? And maybe what's something that you might have done differently and gone about it? Because oftentimes in life, we live these successful lives, but we always want to make alterations towards it. What advice would you recommend to those people trying to go down your route?
That's a good question. Yeah, I mean, I think one is you have to really like what you do. Um, so there are lots of different ways to provide medical care, to be a medical professional. First thing is find something that you really enjoy, that really drives your heart and your spirit. Um, you want to make sure that your life is balanced. We talked a lot about that early on,
Hmm.
and I think that's a takeaway from my life. I didn't have at times in my life the balance that I was looking for, or needed, or required. Um, and then don't be afraid to change it up. So if it's not working, change it.
Absolutely. That's fantastic. Well, thank you, Ed James, for being on my podcast. This has been an episode of Off the Mat, your mental health check in for athletes across the world and for new families, as well as people going into the medical field. I'm Sean Williams, and we'll see you next time.
Thanks.